Have you personally ever lost a cat suddenly with no warning, no time to prepare, and really no clear answers in the present and in the aftermath? One day your cat is eating, playing, and seemingly acting totally normal, and the next they're gone. If that has happened to you, or if you're a cat owner who lives in that quiet fear that it could happen, this video is for you. Today, I'm going to talk about the most sudden causes of death in cats, why it does happen so often, more often than many people think, and most importantly, what this does and does not mean about the love and the care that you gave to your cat. Is it your fault? Because sudden loss is so devastating, and far too many owners do blame themselves, and they shouldn't. But before we begin today, I'd like to welcome everyone to Senior Cat Wellness 2, the companion channel of Senior Cat Wellness. And whether you're brand new to this channel or Senior Cat Wellness, I encourage you to subscribe to both channels and turn on all post notifications so that you never miss a video or videos here at this channel or at Senior Cat Wellness. Additionally, if you'd like to make other generous contributions to the Senior Cat Wellness brand, those links and options can be found on screen near the conclusion of this video and in the description box below. And once again, welcome to Senior Cat Wellness 2. First, I want to say and make this very clear: if you've suddenly lost a cat, you did not fail them. If you know without even thinking twice that were a responsible and loving owner to them, and continue to be, if you care for other cats, you know your heart and you know your place in terms of your responsibilities. And if you were acting accordingly and in good faith, I will assume you did and are and will continue to do so. It's not your fault. So let me go ahead and relieve you of that burden. If you're carrying it, do my best to relieve you of that burden. Cats, as I've said on Senior Cat Wellness, the main channel, and I'm saying here for the first time on this channel, they're very good, unfortunately, for us at hiding illness. Many life-threatening conditions show outwardly little to no warning signs, even if you're really paying attention and you're a loving owner. The goal here is not to scare you to think your cat is going to just drop over anytime soon. It's an educational. Let's take it from an educational standpoint, because that's my objective. That's my goal today. So we're talking about education to bring some clarity, offer peace, especially if you're still searching for answers to the sudden loss of your cat, whether it was recent or perhaps many, many years ago. Most common cause of sudden death in cats is undiagnosed heart disease, especially a condition called hypertrophic cardiomyopathy. And if you are a sports fan, for example, you probably have heard that over the years. There have been several athletes over the last 30 or 40 years that have passed away from hypertrophic cardiomyopathy, also known as HCM. You may have heard it referred to simply as HCM. This disease causes the heart muscle to thicken, making it harder for the heart to pump blood properly. And that's the case in people, and that's certainly the case in felines. What makes this especially tough and heartbreaking is that many cats show no outward symptoms whatsoever. No coughing, no lethargy, no obvious pain. A cat can seem perfectly healthy and fine and still suffer a fatal heart disturbance. It causes sudden heart failure or just a collapse without warning. This is why sudden death can happen even in young and middle-aged cats. It doesn't have to be an older cat, as one could potentially think. It doesn't have to be a cat that's obviously outwardly, visually obese. And that's the scary part here. The goal here is not to scare, but it's that thought is rather scary. And it's sort of just the way it is, unfortunately. Closely related to heart disease is something called aortic thromboembolism. It's often referred to as saddle thrombus. This occurs when a blood clot forms in the heart, suddenly travels to the back legs, your cat's back legs. When this happens, owners may see a sudden collapse, the inability to use the back legs, unfortunately crying out in pain, or rapid and labored breathing. In severe cases, it can be fatal within half an hour, even minutes perhaps, 2 hours, up to a couple of hours. For owners, this experience is traumatic. The visual can obviously be quite shocking, especially when their cat can seem just totally fine, just perhaps even 5 minutes before. Another major cause of sudden death is trauma, physical trauma. This is especially in an outdoor cat, or a cat that sort of splits time between, say, your living room in your home and your backyard. Car accidents, a fall from a height, even a fall from a tree, where they can't really manage the fall, they can't right the fall. Um, they might, hit something on the way down. So perhaps they could have managed the fall if it was sort of a clean fall, but maybe they hit, a branch, a limb of the tree, and suffered perhaps a puncture wound, a fatal puncture wound. Of course, we can't forget we're talking outdoors. They could just as well suffer a fatal injury caused by another animal. Cats are predators and prey, and simply stated, sometimes the cats can come out on the bad end of things. It's just the reality of the situation. Many cases, internal bleeding can occur without any obvious and notable external wounds, meaning a cat can appear totally fine before collapsing because they're not bleeding, for example. They're not showing outward signs of being attacked or suffering an accidental fall or what have you. Toxins, poisons, that's one that I think is more people can recognize as that would be a common cause of a sudden death. Your cat got into something. In layman's terms, your cat got into something. I think that's something we all fear. Indoors, outdoors, a garage setting, getting under a car, licking motor oil, whether it be outside or on the garage floor, paint, you name it, weed killer, grass killer, anything of the sort. Toxins, cats are extremely sensitive to toxins. Even small amounts can be fatal. Different lilies, we're talking about plant life here. That can cause rapid kidney failure, antifreeze. Insecticides, pesticides, I mentioned the grass killers and whatnot. Human medications, acetaminophen. Here again, if you dropped a tablet, dropped a pill on the floor, perhaps in your bedroom, and it's now sort of, buried, if you will, within the carpeting. You can't find it, didn't see it. Maybe it hit the ground and bounced under your bed, and you didn't look there, and cat got under the bed. I mean, it's just we're all aware of this potential reality. It's often reality we don't want to face, that cat could get into something, and while you're well-meaning, it just happens. Some toxins can act very slowly, while others can cause be fatal within hours. And many times, using the medication as example, a lot of owners never realize their cat was really ever exposed, because let's just be frank about it. Unless you see your cat lick motor oil or consume something, you might not even know that it ever even happened. Cats can also die from undiagnosed internal bleeding. I mentioned fall, but this is a little bit different. This is maybe they have a tumor on the organs, maybe on the liver. The liver could rupture, spleen could rupture without warning. Internal tumors, they can grow for months and years, causing no symptoms until there's a sudden collapse, rapid blood loss. This is far more common in older cats, but it can happen to a feline of any age. Respiratory events, respiratory distress is another potential cause for sudden death. Severe asthma attack, fluid in the lungs due to perhaps heart failure, undiagnosed heart disease, heart failure, airway obstruction, that can progress quickly. Some of you know, if you've been a long time regular guest, subscriber to Senior Cat Wellness, the main channel, I mentioned Frosty, cat I had Frosty, long-furred cat. We did, everything was done to properly try to groom him. He was very young, about 2 years old, and he, sort of long story short here, obstruction of the airway. He had consumed a fur ball, because when cats groom, for every bit of it that's pulled out, kicked aside, what have you, some of that is going to be in the mouth and digested. Well, most of the time it's removed through bathroom, through using the litter box, or it comes back up, it's vomited back up. But sometimes there's an obstruction, whether we're talking about in the digestive system or just any sort of obstruction. But in the case of Frosty, as he attempted to regurgitate the piece of fur, it didn't make it all the way back up. So he got choked. It's almost like the inverse of what we would consider normal choking. It's not like he choked on something on the way down. He choked as the fur was attempting to come back up. It was blocked. It was quick. I don't even think it was 60 seconds, and he was gone, just like that. But from start to finish of knowing anything was wrong to the realization he was gone, it was quick. 90 seconds, I would say, at the very most. So, to an owner, it may appear that a cat suddenly can't breathe. And that will be the case. If an obstruction, they can collapse and they can sort of pass away without any warning. It's only sort of in retrospect, in respect to, say, a fur ball, that you find out after, when a vet would look the cat over and realize they would be able to get to and see this obstruction. And in the case of Frosty, I was told, it was just a situation where there's nothing that could have been done, couldn't have done any more. That was just going to happen. It was just an unfortunate outcome. Neurological events, seizure, stroke, brain tumor, go unnoticed for a long time, a year, potentially, depends on what we're talking about in terms of the underlying issue. It's not until a catastrophic event occurs that you know that anything was ever wrong, and unfortunately that catastrophic event could mean death. A seizure that lasts too long affects viral areas of the brain, for example, can interfere with breathing and heart function. One of the hardest things for owners, and I don't care if you've owned 25 cats over the course of 40 years or whatever, to see a cat die without warning. It's easier for us as people. Let me first say it's never easy, but in this context, it's easier for us to understand if we see something happen to a cat, or we're aware that they have an illness, and we see them pass away, but even in that moment we understand why this has happened. It's maybe expected to happen, but the death without warning is, in my personal view, that's another level. That's a little bit of a harsher level to cope with, to understand. Cats are biologically wired, here again, to hide in mass pain and weakness. In the wild, showcasing this situation, whatever it is, can be vulnerable. They can put themselves exposure. You're picking on the weak here. Survival of the fittest. Cats are predator and prey, so if they look weak, they're in trouble. Not only with other cats, but just with other animals in general that can tower over them and prey on them. Because of this instinct, sometimes by the time symptoms are visible, the condition is often already very critical. Even with responsible care, even with being vigilant, it's not. Some owners can just miss it, even if they're certainly well-meaning. If a cat dies suddenly and the cause is unclear, the vet can certainly find a way to figure out the true cause, to know for certain what really happened. This is especially important if there are other pets in the home. Now, you want your answers for closure, but if it's some sort of a mystery situation, your other concern is how, I don't understand why this pet died. Could my other cats be in jeopardy? Could my other dogs be in jeopardy? So it's important for a variety of reasons to try to find out exactly what happened. If toxin exposure is suspected, that's another. You need to figure that out. And here again, it's also closure for you as an owner. For many people, understanding the reason why can help ease some of the pain, just because you have those unanswered questions finally acknowledged and answered. And if you're watching this because you've lost a cat suddenly, whether it was this week or 10 years ago, very, very sorry. Sudden loss can leave behind your own personal shock and guilt, heartbreak. There's a tension and a sadness that hangs over your home for quite some time. I see a lot of things that remind you of your cat, right? Because you never expected this to happen. So things are just sort of left as they were, if you will, and that can be very tough. But in most cases, just know there's nothing you really could have done differently. Loving your cat, providing them with a safe home, and caring for them deeply, it mattered while they were here. And sometimes you just have to understand that was all you could really ever do in some cases. To the wonderful audience of Senior Cat Wellness, too, I realize this is a very emotional, very difficult, rough topic to talk about, rough subject matter to think about and discuss, but if any of you do have anything you'd like to share concerning today's presentation, that comment section, as always, it's all yours. If you enjoyed this video, at least from an informational standpoint, and found it helpful, please give it a like, share it out, subscribe to us right here, Senior Cat Wellness 2. Until next time, I'll talk to you later.